I think initially in the NICU, in the first few days of life, they introduce all these risks that our children could be facing: blindness, cerebral palsy, cognitive learning issues. They cover the whole gamut. This could be the situation or situations. It really wasn't until the first full year of life, we're going through steps of therapies and doctors and professionals that kind of would hint at the fact that they may have some physical developmental problems, cognitive problems, but they couldn't really tell because they're so young. When they became 1 year was when the diagnoses of cerebral palsy, started filtering in. Learning issues when they became preschool, that kind of age.
Really, Emily's more involved than the other ones. She's not in a wheelchair, but she has a walker. She can use some canes.
Natalie walks independently, but she has like an awkward gait. She's a tendency to not look down when she's walking, so she will tend to trip on things. Be a little bit more apprehensive about approaching a curb, things like that. Her disabilities also impact her cognitive awareness, her ability to learn not as quickly as one would think a 9-year-old would learn. Mary has a pretty mild form of cerebral palsy. She also gets around pretty well independently. Occasionally you'll see her, in gym class where there's really an intense requirement for physical involvement. You'll see a little bit of lack there with Mary. Heather gets around pretty good. She has a lot more learning issues that are coming to the surface now as she's getting into the heavier grade, curriculums, things like that. So her disability is more in the area of the learning issues.